So let's talk about why JAMSS is important. And there's really several perspectives. So we can talk about why it's important from a patient perspective. We can talk about why it's important from a practice perspective. So I want to first think about it from a patient perspective. I think all of us would agree that our goal is to have our patients have a predictable level of health and function around their oral environment through their entire lives. And really, when we think about our jaw joint specifically, it's one of the few joints in our body that really doesn't ever get any rest, because we're either talking or we're swallowing or we're eating or we're singing or we're doing something, and that doesn't even include people who parafunction. So this is a part of our bodies, our physiologies, that's under use all the time. And when we do start to develop some sprain or strain, and we actually like those words specifically because patients know what those are. Really easy for patients to relate to something that would happen to an ankle or a finger, and they're already doing the same home care therapies when they experience those symptoms. So I love that semantics works to help them understand what's going on. They automatically start to develop habits, just like when you have a sprained ankle, that can lead to different functional patterns and then set them up for even bigger problems down the road. So being able to assess this and find the risk factors on the front end to prevent that cycle from beginning can be really important for our patients so they have a lifetime full of health and comfort and function. When we think about why JAMSS is important in our practice, I can think about it from several perspectives. When I have a patient in my practice and they have a problem post-operatively, they come in for a routine dental visit, whether that be a hygiene visit or it's actually to have some restorative dentistry or potentially even a longer visit. And when they leave, they have post-op discomfort that they were not helped to understand might happen, that they don't know how to manage, that can often drive them to being uncomfortable for days or even lead into a more significant issue. That really sets us up for not being successful. They think poorly about our office. It reflects poorly on just the experience of having dentistry done. It can now set that patient up to be that much more anxious, fearful, and reticent to have future dental appointments because they don't want to have that happen again, and so they're going to be less likely to manage and maintain their oral health. So we really want to set our patients up for a successful relationship with dentistry, and we really want to be the advocate for their health and thinking about them not having those post-operative issues. So that's another reason that it's very important. The last piece that I want to touch on has to go with what we know from science and surveys. And all of us have patients in our practices who have chronic long-term issues with TMD. And we can understand and know how difficult that is for the patient, how it affects the quantity of their happy times, their being pain-free, the quality of their lives. It also can be very difficult to treat and to help that person get past that. And what we know is a large number of patients report that those chronic episodes of TMD actually were triggered by an acute incident that followed a dental appointment, and that can be one of those main triggers. And so we want to make sure that we're going to find those patients at risk, we're going to think about our procedures at risk, and that we want to take that opportunity to make the best experience for our patients with the least post-operative risks. So JAMSS is easy to implement, and it's an effective way to help our patients stay healthy, pain-free, and functional.